Earlier today, Olivia Munn announced that she has been quietly battling an aggressive form of breast cancer over the last year in a very emotional and educational post that I wanted to break down for you because there is a lot to learn here. My name is Dr. Robin Roth, aka the Boobie Docs. I'm a board-certified radiologist specializing in breast imaging. While I am so sorry to hear about her breast cancer diagnosis, I am so grateful that she chose to share it in this manner because she will help countless people like her that are high risk and don't realize it. So in her post, she reveals that she was tested for over 90 different cancer-causing genes, including BRCA, and thankfully came back negative. This is an important point because most people that are diagnosed with breast cancer do not have a known genetic mutation. She also reveals that she had a normal mammogram 2 months earlier, and thankfully her doctor decided to calculate her breast cancer risk assessment score, in which she found out that she was high risk for breast cancer based on her family history of breast cancer, the fact that she had a child over the age of 30, and likely dense breast tissue, considering that her mammogram was normal 2 months earlier. And we know that dense breast tissue makes it harder to find small breast cancers and is also an independent risk factor for developing breast cancer, so it's like a double-edged sword. Because of her elevated lifetime risk of breast cancer, she was then sent for a breast MRI, and that is what detected her breast cancer. This really emphasizes the important point that you could be negative for a genetic mutation, but still be considered high risk for breast cancer based on a number of risk factors, which I'm going to go through. One of the newer recommendations that has come out is that all women should have a breast cancer risk assessment before the age of 30, ideally at age 25, so we can best identify women that are high risk for breast cancer and would benefit from earlier and supplemental screening. We would start annual breast MRI as early as age 25 and add on an annual mammogram beginning at age 30, ideally alternating every 6 months. This is ideally done with a healthcare professional like it was in her case, but you can find out your own breast cancer risk score using the Tyrer-Cuzick calculator. Google it. Using the online calculator, you could enter your age, your weight, your height, when you had your first menstrual period, if you've been pregnant and what age, if you have any known genetic mutations in your family, and any prior breast biopsies. It's also going to ask you your breast density if you know it. You could find out your breast density by reading your mammogram report. If you read heterogeneously or extremely dense breast tissue, then you have dense breast tissue. The calculator will also ask if you are of Ashkenazi Jewish descent like myself, because we are more likely to carry BRCA mutations than the general public. It will also ask a very detailed family history, including who was diagnosed and what age they were diagnosed, because all of that goes into play. After plugging in the information, it will give you your lifetime risk of breast cancer. So average risk is about 12%. High risk is considered 20%. In Olivia's case, she was 37%. I would recommend that if you see over 15%, then you'd want to seek out a high-risk clinic or even a breast surgeon's office, which can help you understand your breast cancer risk and also find the best breast cancer screening tool for you. Now, I've been getting lots of questions as to why her mammogram was normal 2 months earlier and how she could be diagnosed with an aggressive form of breast cancer that was only seen on MRI. And I think this is a really important point to mention that certain types of breast cancers are more aggressive. Like in her case, she had a luminal type B breast cancer, which is fast growing, and it can pop up between mammograms and grow really fast. Also, it's important to mention that mammography is not perfect, especially in women with dense breast tissue. Having dense breast tissue makes it harder to find small breast cancers. Using mammography alone also increases your risk of developing breast cancer by up to 4 times. So it's like a double-edged sword. If you have dense breast tissue, I would consider adding an ultrasound or MRI to your annual mammogram, depending on your risk factors, to help us find breast cancer at an earliest, most treatable stage. Given Olivia's aggressive subtype of breast cancer, if she would have waited the 10 months to get her next mammogram, she would have likely had a very different outcome. In the post, she mentions that I'm lucky, we caught it with enough time that I had options. I want the same for any woman who might have to face this one day. Ask your doctor to calculate your breast cancer risk assessment score. If it's greater than 20%, you would want to add an annual MRI in addition to your mammogram beginning at age 30. I'm a firm believer that early detection is the best protection. I strongly encourage everyone to find a knowledgeable healthcare professional who can help you understand and lower your breast cancer risk, and also find an appropriate breast cancer screening schedule based on your breast cancer risk. I also am a firm believer in the monthly self-breast exam, especially if you are not being regularly screened with mammography and or MRI. About 80% of young people find their own breast cancers. Women who are high risk should also consider risk reduction strategies such as medications like tamoxifen and or surgery such as bilateral mastectomy, which she ended up having. Olivia, I am wishing you the best of luck on your breast cancer journey and truly thank you from the bottom of my heart for sharing your diagnosis in such an open and educational way, because this will help countless people that may be high risk for breast cancer like you and may not realize it. So thank you. This is also a shameless plug for my podcast, The Girlfriend's Guide to Breast Cancer, Breast Health and Beyond. It's designed to help anyone who is navigating or supporting someone who is going through a breast cancer diagnosis. Olivia, when you're ready to talk, I'm ready to listen. My DMs are open. As always, follow the Booby Docs for more of the breast information.